So I'm going to take this last segment now to review the vast amount of resources and help desks that are available to us as LTAC providers to seek further guidance from anything that we've heard today or anything that we may have future questions on. And again, we have a number of acronyms in the presentation. Here are some slides for recommendation for you to take a review of. And after today's presentation and the demonstration of using the website to navigate the LTAC QRP resources and help desks, you should be able to access the frequently asked questions for the LTAC QRP. We'll review the Medicare administrative contractor contact information used to correct or update facility information. And finally, we'll review the LTAC compliance information and requirements. Our objectives today will include identifying the resources that are available to assist us with understanding the LTAC QRP, and then we'll hopefully become proficient in locating and navigating through these resources when we need to call on them. As with all of our presentations, the information is current as of today's presentation and when it was published to the web. As Medicare policy changes, the links to the source documents are provided so that you can reference the most current resources when you need them. So now we're going to switch over to the live CMS.gov website. And the most simple way to actually get to the LTAC resources is to go to CMS.gov, and from the home page in the search section, just type in LTAC and hit search. And right at the very top there, the first selection that you get is the LTAC quality reporting landing page. And so when you click onto that site, here you can see all of the links that are available to us with all of the resources on the specific topics. The purpose of this landing page is to provide us with important announcements and updates regarding the LTAC QRP. The page is updated periodically whenever an important update is needed to be communicated to us as providers. Refer to this page when seeking information on our upcoming trainings, on approaching data submission deadlines, updates to training materials or measures, reminders, and other communications from CMS. And then links to the actual federal acts and quality reporting are also found on this page. So the first link that we'll go to is the Reporting Spotlight Announcements page. And here in chronological order are announcements that have been placed on the site that are meant to draw our attention to new doings with the LTAC QRP. There's also some convenient links to some materials down at the bottom of the page. And this is the same with all of the links that we're going to go through today. And you can see there's an extensive history maintained on the website for you to reference as needed. So just coming back up to the top here. So the next link is the LTAC reporting measures information. And this one is particularly helpful as it provides the launching pad directly to the LTAC quality data submission deadlines page, as well as the LTAC care data set and LTAC QRP manual pages. And you can get to them from multiple sources, but this is probably the most convenient. And again, at the bottom of the page, if you go all the way down, there are a number of downloads that are available for us, both historical and current. You can see the quality measures currently adopted is right at the top there. And if you click on any of these files, it'll bring up either a zip file or PDF that you can then further dive into. The next link is to the care data set and LTAC QRP manuals. So again, we could get to it from that previous page, but here is the primary source page as well. And this This site is particularly helpful as we transition over to version 4.0. We can locate the new manual change table as well as the manual version itself right here on the website. So these are definitely going to be resources that when you get back, if you have not yet taken a look at them and shared them along with your teams, you're going to want to pull those down and review them and get the most up-to-date information. You can also see that prior versions are here as well. So our 3.0 manual, which we'll use through the rest of the time period up until July 1st, is there as well. The next site is the LTAC quality reporting technical information. And here we have for us the technical specs for reporting our information and for our data collection and submission. Again, at the bottom of the page, there are links to all of the technical specs if you needed to provide them to any resources in your facility to assist you with submission of the data collection. The next link is a very important one because all of today's materials are going to be at the LTAC quality reporting training link. So here, if you have not already downloaded today's presentations and the ones from yesterday, this is where you'll find them when you go back, as well as any of the updated slides that have the answers filled in as was requested. Our agenda was here today. So any training materials for any of the LTAC QRP trainings that you attend, whether they be online or in person, are all listed here. The LTAC QRP provider training is actually a zip folder. So when you click on this link, I'm not going to do it. It takes a little while to download on the Wi-Fi, but when you click on it and you open it up, you get a list of all the sections, all their presentations, and their each individual presentations are available for you. The next link is the quality public reporting site. So just as Tree discussed, we are all aware of the quality reporting process now that he shared his presentation with us. But we also have any announcements and any links that we need to be aware of, as well as the LTAC Compare fact sheet. So if we're looking for sharing information about the LTAC Compare site and what that means to us as a facility within our teams, we have a reference document there as well. A schedule of measures that will become publicly reported is also available on this site, and I believe it's up at the top. So you can see here any of the most recent items that are on the LTAC Compare website are out there so that we know what's up and coming. So as new ones are added to the Compare site, we would be made aware of them on this page. The next link is the FAQ site, and so again, here you can find a bunch of resources as they're made available. Right now, there is the LTAC QRP facts from the August 2017 presentation, so if you had been looking for a response on an FAQ, you can certainly find them on this site. And the next one we're going to jump to is the quality reporting data submission deadlines. And so here we have updates and notices that are provided to us about the collection timeframes and submission deadlines. I always like to post these in our department to make sure that we're all aligned on when we're going to be reporting. But these are available for our reference and for us to print down as well. And then we have the LTAC quality reporting reconsideration and exception and extension site. And that's exactly what it says it is. And here you would be able to find information about the reconsideration process for the LTAC QRP and any guidelines and processes to submit for reconsideration. And I'm going to go through some of the help desks that are available as well, so that will make more sense to you when we do that. And then we have the LTAC quality reporting help and reporting archives as well. So as you can see, it's all nicely outlined for us. The resources are available at our fingertips. I know sometimes I'll be looking for an email, oh, where was that link that they emailed me? And it's right there. You don't have to go searching for it. It's right on the LTAC QRP website. And that was simply accessed by going to cms.gov and then in the search area typing in LTCH. So we'll switch back over to the presentation now. So the Federal Register holds the proposed and final rules, and they're typically released in April and August of each year. It's really good practice to review the rules when they're in their proposed form so you can get a jump on what may be coming down the pike. But you can also provide feedback, and you can begin to prep your facility for anything that you think may be implemented in the final rule. And on this slide here, we have the links for the Federal Register, so you could access them primarily and review. In addition, here are the links to use to have notices and announcements about the LTAC QRP sent to your email directly, and also the link to receive notices for the open door forums. And if you have not participated in the open door forum, this is really our opportunity as providers to provide a voice during the development of new standards and new measures, and really be part of the process. So this is a great opportunity. And certainly having the updates emailed to you directly is a great benefit as well. There are a number of help desks offering a variety of resources and support for all of us, and we're going to go through each of these in detail in the next slide. As always, it's really important to remember to protect health information, and so the CMS QRP help desk email systems are not secured systems, and therefore you should not submit any inquiries which include patient information or patient identifying information, including date of birth or social security number or health insurance number, etc. So this is probably very small in the screen, but what it's showing you is that you have a number of the help desks available with specific purposes, as well as their email contacts, so that you could email them directly. And again, we're going to go through them in each subsequent slide, but this is a great quick reference tool that if you're wondering which help desk to reach out to, you can quickly reference this one. And this slide is just an expanded version of that so that you can see how they're set up with the specifics on why you would access that particular help desk, and then the email as well. So the first one is the LTAC QRP help desk, and this help desk provides us guidance for questions related to the LTAC QRP requirements, including data collection and data submission timelines. You can reference this help desk for any items related to the LTAC care data set, how the quality measures are calculated, the LTAC QRP training materials, and generalized QRP questions. So this is really, if you're not sure where else to go, this might be a good starting point. And the next help desk is the CDC NHSN help desk, and so the LTACs can reach out to the help desk, this help desk, for guidance on the CDC quality measures such as CAUTI, MRSA, CDI, influenza vaccination coverage for healthcare personnel, and the VAE measures. You can also reach out for any NHSN reporting, enrollment, and analysis questions. As an LTAC provider, if I need clarity on any of the topics covered in Chapter 5 of the manual for the LTAC quality reporting program, this would be the help desk that I would reference. The next help desk is the LTAC QRP reconsideration process help desk. It's a resource when an LTAC needs clarity on filing a request regarding the receipt of a letter of non-compliance from CMS, or needing the deadline for filing a request for reconsideration, and how an LTAC can dispute a non-compliance finding. LTACs can also seek information on the LTAC QRP payment reduction for failing to report the required quality data by reaching out to this help desk. If an LTAC is in need of assistance with accessing the keys, the associated reporting in the Casper and Laser system, you can contact the Data Submission and Data Validation Help Desk. Guidance on usernames, passwords, data submissions, validation reports can all be sought through this help desk. The LTAC Public Reporting Help Desk is available for LTACs to contact if they have any issues with reporting periods for the Casper review and correct reports, as well as the interpretation of the results for the Casper quality measure reports. LTACs can seek guidance on the measures in the provider preview report, and the LTAC Compare website and LTAC data on data.medicare.gov, all of what Tree had previously reviewed with us. It's really important that LTACs are comfortable referencing these various reports as they become our public data related to quality in our facilities. If you've not gone into the LTAC Compare website yet and are having any difficulties navigating or interpreting the public data, this help desk is an important one. The LTAC Payment Policy Help Desk provides assistance with LTAC payment inquiries, billing and claims, and eligibility and coverage requirements. And finally, the LTAC Technical Issues Help Desk is available to answer technical questions related to the LTAC Care Dataset submission, specifications, and the validation utility tools. So let's see what we've learned about the help desks so far. Which help desk should you contact if you have a question about the quality measure? A, the LTAC payment policy, B, the LTAC QRP, C, data submission and data validation, or D, CDC, NHSN. I'm going to say we're done because we've lost a few pollers. So our responses show that 85% of us believe that we are to reference D, the CDC, NHSN, and that is correct. Our next one, if you're unsure which help desk to contact, email your question to the LTAC QRP help desk for triage. And this is a true-false, so A for true and B for false. Okay. And 100% of us chose true, and that's correct. Okay, and finally, which LTAC QRP webpage should you visit to access training presentations from today? So if you had not yet already accessed them or you'd like to get the complete version, you can access A, the LTAC quality reporting measure information, B, LTAC care data set and LTAC QRP manual, C, the LTAC quality reporting and training, or LTAC quality public reporting D. And 100% of us chose C, and that is the correct answer. So if your reports have incorrect or outdated facility information, you can use the Medicare Administrative Contractor link below to make your adjustments. You search your state on the map, and then you get a state-specific contact. And there's also a link for the regional office as well, and they will help you to navigate your corrections. This is if you have facility information that needs updating. And this is another link for the LTAC quality data submission deadlines. This is a direct link, and don't worry about writing them all down if you haven't printed the slides. Again, you can find them at the training material and just click right on them. And this is a link for the submission requirements for the CDC and NHSN data collection. So as LTACs, we're required to submit our quality measure data to CMS, as we all know. So failing to do so may result in the 2% point reduction that we've referenced throughout the last 2 days. So that's just a reminder about the importance to have complete data, as complete as we possibly can. So LTACs are required to exceed 2 separate data completeness thresholds. We must reach 80% threshold for completion of the quality measure data collection on the LTAC care data set and submitted in the keys ASAP. And we must also reach 100% of the measure data collection and submission for the CDC in NHSN. I know sometimes we ask the question of how much do we have to submit before we might be at risk for the 2% penalty. So here are your thresholds. And this is a direct link to the technical specs that we showed you the link on the website as well, and it's also available in the QRP manual in Appendix D. At this link, we can find the tables necessary for calculating the LTAC QRP assessment-based measures, which will be used for compliance determination, and items used for risk adjustment and which are not used for compliance determination. So if you're ever wondering how they're calculated, this link will give you some direct information on that. These are the tables that are available at this link, and they show us in a graphical picture what's required for each assessment type. And note that there are some items in the table that are required to calculate the quality measures and are also used for risk adjustment in one or more of the quality measures. So sometimes when we're collecting data, it's for more than one purpose. And in the second table, we see only the items that are used for risk adjustment that are not already in Table 1. So they are used as risk adjusters, and if we don't report them, then our risk adjustments could be compromised. We might not reflect our patient complexity to the best of our ability. And so it's really important that if it's not primarily required for data submission and it's required for risk adjustment, that we report those completely as well. So let's do a knowledge check for our help desks and some of these other items that we've gone through. So what is the threshold for completion of the quality measure data collection and submission using CDC's NHSN? So A, 75%, B, 80%, C, 90%, or D, 100%. And we had 2 levels of threshold. And 89% of us chose D, 100%, and that is the correct answer. The NHSN submission is 100%, and the LTAC quality reporting data set is 80%. Oh, I just gave you this one. So this should be 100%. I know it's the end of day 2, but what is the threshold for completion of the quality measure data, collecting the LTAC care data set, and submitted through the KEYS ASAP system? All right, so 94% of us said 80%, so somebody was stepped away for a minute. Okay. So our correct response is 80%. LTACs must meet or exceed 3 separate data completeness thresholds, true or false. Okay, it looks like we have a good amount of answers for that one. And we had 64% that said false, and false is the correct answer. We have 2 separate thresholds, CDC NHSN, which is 100%, and then our LTAC data set, which is at 80%. So those are 2 separate thresholds. So we have about 5 minutes left. Are there any questions related to our resources that are available to us? I highly recommend that you reference them and take advantage of them that are out there. Okay, well, thank you guys very much.